Mr. Speaker, the plan before the House today is our Plan a comprehensive plan to steer this country through the autumn and winter. But we've seen how quickly this virus can adapt and change. So we have prepared a Plan B of a contingency measures that we can call upon only if they are needed and supported by the data to prevent unsustainable pressure on the NHS. These measures would be communicating clearly and urgently to the public the need for caution, legally mandating face coverings in certain settings, and whilst we're not going ahead with mandatory vaccine-only COVID status certification now, we'll be holding that power in reserve. As well as these three steps, we'd consider a further measure of asking people to work from home if they can for a limited time, if that is supported by the data. Any responsible government must prepare for all eventualities, and although these measures are not an outcome that anyone wants, it's one that we need to be ready for, just in case. Mr. Speaker, ever since we published our roadmap to recovery 7 months ago, we've been carefully but cautiously getting this nation closer to normal life. Now we've come so far, we've achieved so much, we must stay vigilant as we approach this critical chapter, so that we can protect the progress that we have all made together. I think one thing I would highlight, Mr. Speaker, that I haven't mentioned so far today in Parliament is the importance of being on guard against future variants, but especially if there is ever a variant that is let's say, a vaccine escape variant. No one can rule that out. That is why our surveillance system is so important. But in that situation, I think the government would have to take further action. We couldn't say what that action would be today, but that is the kind of risk that we need to be on guard.